I can though.
Can you dance?
I brought a wig.
Allie brought her wig.
It's not gray today, but
Well, this, I don't know how
It's
we
for-
could do this yet and
Where's
make
the
it,
wig?
make it work with this.
I'll
Are you
pretend
ready?
like I
Okay.
can't move.
this is for the meds.
So today we're going to talk about answering, the medication administration questions and how to do that appropriately, because that is one of the quality indicators that we have to be able to show improvement. And when we don't do that, it works against us. It's showing that, if we're saying we're going to go in there and work on medications with a patient, that we have to be able to show that we've done something to help improve this patient's ability to take their medications correctly and safely. And I know as a therapist, a lot of us feel like, well, that's a nurse thing. We don't do that. We don't do medication education. We don't address that. We make sure that we've got all their meds in the computer and we document med changes, and then that's pretty much it. But that's not true. And a lot of us do things that we don't even realize that we do. When you talk to a patient about when they should take their pain medication and how they should take it, when you check their blood pressure and it's high and you ask them, have you had your blood pressure medication today? Well, I got up late and everything. You're doing that. You're doing that. So even as just a therapy-only patient, it's our responsibility to make sure that we're doing this job and we're helping these patients get better. And so when the PT does the start and comes back and does the discharge, we can actually say, hey, we did medication education and this patient's actually better. So one thing that you have to consider when we look at the question for management of oral medications, it says that it's the patient's current ability to prepare and take all oral medications reliably and safely. Now, that doesn't include like inhalers. It doesn't include peg tube meds. It's just the medications that they can put in their hand and put in their mouth and swallow. Okay? So we have to consider a lot of things. From a therapy standpoint, you have to consider, can they physically do that? Can they open their bottle? Can they shake the medication into their hand? Do they have the dexterity to pull out one pill or two pills and put it in their mouth? Do they have the dexterity and the strength to have a glass of water or a bottle of water and swallow those medications? Do they have a swallowing problem that prevents them from doing that? Which would indicate maybe speech therapy can help them. Okay? Those are all things that therapists need to consider when they're answering this question. I mean, nurses have to consider it too, but nurses, tend to look at, do they know what they're taking? Do they know what their dosage is? Do they know what time they're supposed to take it? We all have to consider those things. But one thing that we all don't consider every time is the ability of a patient to get up, go get their medications, and take them. So you've got a patient that's non-weight bearing. They're sitting in a wheelchair. They can't get in and out of their kitchen, but that's where their medications are. So could they be anything higher than a 3 at the start of care? No, because they can't get there. And that's part of the question. They have to be able to access their medications. Okay? But what if that same patient has all of their medications set up right beside them? Okay, they don't have to leave the room to go get them. They can wheel their wheelchair over there because you've worked with their wheelchair mobility. You convinced their daughter, hey, we got to get these meds in here where she can take them, and she can sit here and open up her bottles, pour out her medicines at the right time, and when you go to discharge her, you're saying, hey, she can do this now. And all you had to do was work on her mobility and get the medications in there. So now, even as a therapy-only patient, we've shown improvement. Maybe she's gone from a 3 because it was a mobility issue all the way to a 0. She knows exactly what she's supposed to take and when. And the issue was something that therapy was going to address. Okay? So that's how we're going to be able to show improvement. But one thing that always was a sticking point with me, and I had to research this myself to make sure that I was answering this correctly, is you get a patient that lives in an assisted living. And the assisted living has a policy that says, we handle all the meds. The residents are not allowed to keep medications in their room, even their multivitamin. We give it all. So it's real easy. Okay, 3. Yeah, 3. Yeah. Oh, is the ALF? Do they take care of all your medicines? Yeah. Okay. You go back at discharge. Oh, they live in the ALF. They take care of all their medicines. 3. That's not right. Okay? Because it's not about what they do, it's what their ability is. So let's say, you've been seeing this patient in assisted living, and they are 150% cognitively intact and aware. They know every single pill that nurse is going to bring them and when they're supposed to take it, because they're the one that's chasing that nurse down going, hey, where's my afternoon medications? Because I'm supposed to have this at 3 o'clock. They're the ones that are the big pain in the rear, but they're the ones that know. So are they still a 3 just because the facility has a policy that says we have to hang on to all their medications? No. They know everything. You can assess their manual dexterity, their ability to be mobile, their cognitive awareness, what they take and when, and how many milligrams. And if they can do that, then we can show improvement even if they're in an assisted living where they never lay hands on their pill bottles. So those are things that when you're going back to do your final assessment, you have to take into consideration, especially on these assisted living patients. But, and that's a time where you won't be able to physically see them go through the process. I know that the nurses are really good about sitting down with all of their medications, having a patient go through them and opening up their bottles and everything. A lot of times the therapists don't do that. We do it at the start of care, and maybe nobody touches it again. But we have to make sure that if we're the only discipline in there, whether it's PT, OT, speech therapy, that we're going through those kind of processes. We're making sure that, if they can open a Coke bottle, okay, they can probably open a pill bottle. Hand them one and let them show you, because not all pharmacies are giving patients non-child proof bottles, and maybe they've got a way around it. Maybe you need to make a phone call to the pharmacy and say, hey, can we make sure this lady's medications come in a non-child proof bottle? She don't have any kids here, none come visit, but her arthritis is bad enough that she can't open these. Okay, so those are small things, and that's something that PT and OT can work on. Okay, so that's how we're going to help people make improvements to this medication, because this is a big deal. Because we're not able to show good enough progress, and Karma and I and Lori have all talked about it. A lot of times it's just because the questions aren't answered correctly because we don't know. Okay.
And that's the thing too with our star ratings. It's not that we're showing declines, it's that we're not showing any improvement. So if you were to pull any of the patients, every week we go through our star ratings and we look at every measure, the places where we're not showing any improvement, we can pull it by those patients and see exactly that it's not a downturn, it's just a flat line. So, and if you look at any of those patients and you dig deep and do a root cause analysis on every one of those patients, every one of them shows goals met. So we're not giving ourselves the credit that we deserve when we're doing the beginning of the care to the end of the care. And in some cases, I'm just going to be honest, it's the same person doing the start and the beginning. So with all this education, hopefully, if you have any questions about how to answer that question, all you have to do is pick up the phone, explain the situation, and we'll try to help you through it. But thank you so much, Matt. And I will just say, while we're talking about this, that, now he's a little bit of an urban legend because everybody's calling me, where was your video last week? Because all the other offices are using them. So I really greatly appreciate it, and thanks a lot.